Yes,
Okay.
please, at first election.
Yeah,
But
first
November
meeting after.
Meeting if we have it, or
Yeah.
whatever.
So, are we looking at two proposals that we want to bring forward to the full council? That would be
The look back,
the look back, or,
the nomination.
okay? Is that okay with everybody?
Okay?
All right. I don't know what the next committee is, I'm late getting here, so. Is that Paul?
Infrastructure.
Rob.
Wait, let the
Mr. Cameraman.
TV.
Call the Infrastructure and Property Committee meeting to order. Roll call. Rob Carmichael's here, Paul Bissonnette,
Here.
and Paul Goff.
Here.
First agenda item is Medivision Health Insurance presentation. Sue?
Yes, we have with us tonight Carl McNally, who's the president of Medivision in Bangor, and he's going to do a 15 to 20-minute presentation on a potential alternative to the way that we currently do health insurance. I've talked about this before. It's the process of having a high deductible plan in which which significantly lowers premiums, but the town covers 90% of the deductible in order to keep people's coverage the same. And Carl will explain, he has some information on, after analyzing our both the those covered by the Maine Municipal Program and those covered by the Allegiant Program, which are those the union members are covered by that program. So Carl.
Thank you, Sue, and appreciate the invitation to come and speak with you folks tonight. If you notice on the front page, I kind of changed this from a proposal to a conversation. I think it's important to basically help educate you on what we've been doing for 14 years with 187 businesses as well as 3 other municipalities. So the second page is basically a concept that I have developed over the period of time and believing what I've been doing, because the numbers prove the case, that the best health insurance plan is not the one that costs the most money. It is the one that pays your bill. We have been, as I mentioned, working with very high deductible plans for 14 years and proven that employers can provide a better level of health care for employees for less money than buying low deductible health insurance plans. So the third page in, I kind of make the case with your current plan along with the integrated HRA model moving to the highest or lowest premium plan in the Maine Municipal Employee Health Trust. It is important that you understand that I do not represent the Maine Municipal Employee Health Trust tonight, and so I am basically reviewing the data that they provide to you and comparing it to the model that we use for these other towns and employers. So if you look at the top of that third page in, your current deductible is $200. You keep moving to the right, the proposed plan would move to a $2,500 deductible. You look at the HRA paying $2,250 of the deductible, leaves the employee with a $250 out of pocket. So what is an HRA? An HRA is an IRS term called a health reimbursement arrangement that allows the employer to pay medical expenses on behalf of an employee, and in the case of commercial companies, deduct it, and the employee receives the benefit tax-free. So we, in effect, pay employee deductible expenses as they incur them at some rate of reimbursement. I'm demonstrating here that with the other municipalities that we do, we reimburse employees at 90% of that deductible. So you can see that the deductible on the current plan is $200. The deductible out of pocket in this model is $250. However, the definition of a deductible is something you pay 100% off. So in the case of your current plan, if somebody had a lab bill, they would pay the first $200. In the case with the proposed plan, they would pay 10% of that at a time. So if that lab bill was $300, they would pay $30, not $200. Okay? Coinsurance is the term that the insurance companies have where the insurance company comes in and pays the higher percentage of claim, but still leaves the employee with an out-of-pocket in addition to the deductible. In your current plan, that out-of-pocket is $1,500. It comes in at 20% at a time. So if somebody had a $1,000 lab bill, the employee would be responsible for $200. The plan would pay $8. Again, in the new model, in the integrated HRA model, that coinsurance is $2,000. And in the towns that we represent today, the town picks up that $2,000. So the employee out-of-pocket is $0. So the out-of-pocket between the deductible and the coinsurance in your current plan is $1,700. If you look far to the right, the employee out-of-pocket for deductible and coinsurance in this model is $250. So a much improved health insurance benefit to lower the out-of-pocket cost to the employee. I'll get to how we pay for that in just a moment. In addition to the out-of-pocket between deductibles and coinsurance, there are copays. Most familiar with that in relationship to prescription drugs or office visits. So both the current and the proposed plans have copayments. And in our model, we recommend that the employee pay their coinsurance, their copay as they incur those expenses. So the copay maximum in the current plan is $4,650. In the proposed plan, because it's a lot higher deductible to begin with, it's $1,850, of which the employee in this case we show could incur that expense. So the maximum out-of-pocket is the key thing to focus in on, because the maximum out-of-pocket in all plans under 50 lives is about $6,500. So it depends on how you get there that creates the premium obligations that you face. So you'll notice that the maximum out-of-pocket in both of these plans, the current and the proposed plan, is $6,350. The difference is in the proposed plan, the town takes the responsibility for $4,250 of that out-of-pocket. So that leaves the employee with a maximum out-of-pocket of $2,100, a significant change in those hardship cases where people incur a lot of medical expenses. In your current plan would incur $6,350 out-of-pocket, and the new plan would incur $2,100. So how do we pay for it? If you look at the next section in the illustration here, your current employee cost, this is the single rate annualized, is $11,942.88. The proposed plan is $8,812.56, a difference of $3,130.32. So the insurance carrier is basically saying to you, if you take responsibility for the smaller claims against a high deductible plan, we'll reduce your premiums to $3,132. Now, why is that important to you at this point in time is because I'm reporting to you that the average cost per person runs about $600 a year in municipalities for reimbursement of the plan identified here at 90%. So if we look at this from the financial total, of employees and dependents and what you're currently paying. If you turn the next page, I think you can probably read through this on your own. I'll take a few questions in a few minutes. But you're currently paying, the town is, if you look at the top piece, based on the number of persons in your plan with the Maine Municipal Employee Health Trust, the town pays $222,105.28. The employees pay $25,376. We move to the new model. It drops the contribution to premiums for the town to $157,243.12, or a premium reduction of $64,862. It's this $68,862 that we use to pay the expenses that we discussed on the other page at that $4,200. So in this proposal, we're also holding the employee at the current contribution. So we hold the employee at the current contribution, but we lower their maximum out-of-pocket potential from $6,350 to $2,100. We lower their co-insurance from $1,500 to $0. Any questions so far?
So the $64,000 savings, part of that is paid by the town paying $4,250 per person, correct?
Say it again?
This HR, on the page before,
Yeah.
the HRA at the top,
Yeah.
is that town payments?
No, that's potential claim liability. So if somebody had a major hospital claim, the town would pay $4,200 on behalf of that person.
Correct.
We would take that $4,200 from the $65,000 premium savings.
Okay, but, so, I'm just looking at your other numbers. If we have 27 people that were insured,
Yeah,
and each person has $4,200,
that's correct.
that's over $100,000.
What you're
That's
saying,
correct.
though, is that 90% of the people, let's say 90 to 95%, don't even reach their deductible. So
That's correct.
it claims in a year.
So you're taking the risk for the other 45,000?
No, I'm not taking any risk at all. I'm a third-party administrator to administer the plan for the purpose of a HIPAA compliance. Okay, so we see data reported to us on claims that you would not want to see.
Right.
And as a result of that, we are hired to pay out the benefit that you decide you want to pay. Yeah, so we're TPA.
So that the 65,000 basically is a hedge against people reaching their max out of pocket. The 4,200, whatever it is, if everybody reached their max out of pocket, or a majority of them, you're going to cover that 65,000 savings plus the other one would cover that.
Well, you would.
But the fact of the matter is, most people don't even come close to reaching max out of pocket. You mentioned the average savings. The average cost is $600.
$600.
So your data is basically showing that most people don't do that, and that's where
Yes.
the HRA, if it's not used, stays with the town of Bucksport.
Yes. This is kind of a unique situation because for the 187 companies that I insure commercially, we're insuring $5,500 to $6,500 deductibles at a cost of $500 a year, because they generally pay 70%. Okay? The town, in the municipalities, you retain your co-pays on your co-insurance, on your prescriptions, and you retain your co-pays on your office visits. So that's different than the commercial plans that we do. So we do have data that I'm going to show you here shortly as to how these other towns actually panned out. So down at the bottom here, this page that we've been talking on, I have a few notes. So I titled it, "The Employee Contribution to Premium Stays the Same." That's what we've done in the other towns. Bucksport's contribution to premiums reduced $64,000. The estimated number of insured persons is 27, even though we only have 12 employees. And estimated HRA claims against the savings is 13.5 to 16.5. So to answer your question, Mr. Stewart, we would expect that your claims to run somewhere in that range out of the 64,000. Okay? But you are correct. Actuarially, you're responsible for the full dollar amount on every employee. But I would say that if every employee met the maximum out of pocket of your health insurance plan, the health plan would not be the problem. Go ahead.
I got a couple questions. Question one, you say the employee still has to pay their copays. What are their
That's
present copays right now? Under
Well,
their present plan?
I can show you that on another page here, but they're basically the same that you pay now for prescription copays.
Oh, I understand that, but, oh, so you're not raising their copays?
No. Well, no.
Well, that,
No, the copays on the prescriptions
missing.
for the 30 and 90-day supplies are the same.
okay, so you're not, in other words, you're not raising their copays?
Right.
Okay.
There is a copay increase on office visits, like $5 more, okay? If you go down through that list, which I'm sure you're gonna have time to look at this
I
at some
understand
point.
that part. That-
Okay.
no, I expected actually a raise in the copay.
Yeah, very little difference in the
Very
copay.
little.
Now,
But the difference in out-of-pocket is
Oh, 100%.
between 6,300 and 2,100,
Oh, I think
more
it-
than compensates for a $5 office visit.
100%.
Yeah.
One other quick question.
Yeah.
So, are they gonna save any, I understand the town's gonna save $64,000. Are the employees gonna save any, other than the out-of-pocket, I meant a month,
yeah. Well, first of
a
all,
payday?
the town does not save $64,000. The premiums are reduced $64,000. The
Right.
town takes on the liability. Now, we estimate the town might have a net savings around $45,000. Okay?
Okay.
So, yes, the employees out of pocket, in my opinion, will always be less than it otherwise would have been with the current plan. Because the $250 out of pocket is not a $250 deductible all at once. It's a percentage. It's at 10%. All right, there's a color graph in here that demonstrates what the other municipalities have been doing. Some have been with me for 4 years and one for a couple of years. And so another thing that we do is we track data. Or claims coming in, we record what that is. That's why I can stand here and tell you tonight that the average cost for a person is going to run around $600. So we have three towns, ABC I've called them, keep them different. The employee population, when you're reading this, is the blue, the deep blue, is 2016, and beside it 17, 18, and 19. And you'll see that two of the towns are pretty good size. There are 56 employees in 2016. And 53 in the other town, while the smaller town is 41.
So is that employees or is that covered folk?
That's
covered people?
this is employee in this particular graph, because what we're trying to do is to show you what the cost per hour is for your employee in reimbursement. So if you look at the first top right-hand bar graph there, it's talking about the number of eligible employees. You move to the right, that is talking about the actual payout of claim activity on those employees only. So for example, if we stay with the bar to the left, we had 56 employees in Company A who were reimbursed $39,994 collectively. And down in the bottom left, that amounted to 34 cents per hour, a little over $500 in benefit for the year. Same is true from year to year. The bar furthest to the right-hand bottom, if you look at the blue bar, it says $64,325. The difference between the $64,325 and the $39,994 is what the dependents were reimbursed. So this town reimbursed $64,325 in actual HRA reimbursements on that population of persons. Our smallest town had 41 employees, and you'll see there in the bottom left, their cost per hour was 9 cents. We reduced the premiums in that town by over 120,000, and we spent about $12,000 in 2018, and we spent $6,500 so far this year. So that would not necessarily mean that your town would be the same. They're all a little different. But the data would suggest that a move in this direction would be a substantial reduction in the pure cost of insurance to the town. The next page, I have graphed out the plan. It's the PPO 2500. It mimics the presentation from the Maine Municipal Employee Health Trust. The only thing I've done is I've put the HRA in the middle in blue, and I've shown the employee out-of-pocket to the right in the light green. So this is a piece that you certainly want to take a look at on your own, but it will back up what we've discussed thus far.
There's no change to the prescription cost per employee.
No, the prescription cost, if you look on that sheet at the bottom, you'll see the prescription copays right there. They're $8, $15, $35, $60, and $80 in both plans for a 30-day supply. And so I also show that the HRA would not be paying in that on those copays.
And this back one is what we have now.
Yes, that's correct.
The HRA funds carry over from year to year, or do they expire?
The HRA it's a health reimbursement arrangement, so it's completely owned by the employer. Thank you for the question, by the way. It's completely owned by the employer and funded by the employer. So employee cannot make contributions to the HRA, so there's no carryover.
Okay.
Yeah.
No, so, but I have an HRA, and I don't know how to ask this. So I have a Benny card, okay, and I get a certain amount every year, and then I can roll over a certain amount to have a cap. I have a cap, I have a $3,000 cap that I can have at all times.
Talking about HRA or HSA?
I don't know, I got a Benny card.
Right, so with this, right, with
They
this,
tell me that, they tell me I can use it for medical expenses.
Yeah.
yeah,
I
but
don't go
with
to the
an
doctor, that's why so.
that's funded by you with an HSA.
No, it's not funded by me. I pay zero.
Some
that's my
communities have
question.
chosen to have individual HRAs for every employee. The proposal here, and we did this in Hamden, that there is a lump HRA that's established by the town as part of its budget on an annual basis, and that lump is what pays the 90% of these deductibles up to a certain, but if there's money left in that, what we did was we didn't dump it and reappropriate it, we added to it to bring it back up to a certain level. But it wasn't a guarantee of handing everyone. It was a way for people to have 90% of their... I use the example that when I had my hip replaced in 2015, Hamden had the highest level of the POSC plan through Maine Municipal. It was the highest premium plan that you had, and that was available. It was, I don't know, $800 or $900 back then, dollars a month. My out-of-pocket was $1,000. The town went to a $3,500 deductible plan where the town paid 90%. If I had had my hip replaced then, my out-of-pocket would have been $350. And the town saved there, I think it was $260,000 in premiums, but it was a much larger employee base. But the the point being that the benefit to the employee is, it isn't about how high the deductible, it's about how much is coming out of their pocket on a, and it does require that employees, they don't have to write a check and be reimbursed. This is a pay up front by Medivision. People don't have to take that 90% out of their pocket and wait for reimbursement. And the point of this, and we have another item on the agenda, is I wanted to start this conversation and have Carl come and talk about what this plan does and how it's worked in other communities, because we have talked about wanting to make sure that we can provide good health care for our employees, and good health care doesn't necessarily mean high premiums. Good health care means that the amount out of their pocket is reasonable on an ongoing basis. But if there's a way for that to happen in the out-of-pocket for the town, if the town were spending $16,000 a year to write checks for care for their employees, paying bills that people actually incurred medically, I would suggest that that's a better use of the town's money than paying it in a premium. Because if you provided the coverage of the premium and that difference is actually paying for care, it's a better utilization of the
I think
town's
it's definitely
funds.
worth, I just negotiated something similar to this, and the point I was making was if most people don't hit that deductible, so they're concerned about their max out of pocket and that money in between, and if you can provide a pool of money that the town owns but is paying that, it gives them great comfort. And in many cases, you may have good years, you may have bad years, but in many cases, you won't use, all of those funds.
But even the maximum, and please correct me if I'm wrong, but the maximum liability to the town would be the premium paid by the town.
Yeah.
And then if everybody on the plan, and there are approximately 27, that's the estimate provided here, takes the full amount of their HSA, that's the maximum liability to the town, correct? So it would be that
Right, you
4,250
have those
times
two numbers,
27.
just in using multiplications of math, yes.
Well, that maximum liability to the town, if everybody takes that, is,
Yeah.
if my math is correct, is about $40,000 higher than what we're paying right now per year. Is that right?
Could be,
Yeah, well, yeah,
Likely would be,
4,250
yeah.
times 27,
Yeah.
yep, it's
Yeah.
about $105,000, okay.
right.
Yep.
And Sue, I think you answered the question. Paul had asked if it rolls over, and theoretically it does.
The town maintains that
Maintains
pool
that
of money.
Right.
Yeah.
The town doesn't lose it.
Right.
Or
No.
the employee doesn't lose it.
There's no lost ability for the
Right.
employee to recover their 90% of.
We've been doing this for 14 years, and we've been tracking this data for the last 6 or 7 years more closely. And we serve between 5,000 and 6,000 people with $5,500 to $6,000 deductibles. And less than 1% of that population has had claims over $10,000. So about 120 people out of that group has claims that exceed $7,000 to $10,000. I don't know how high they go because we only track the deductible amount, but we are paying too much for health care, and even with this consideration, you're still going to pay too much for health care. But there's no other way around it because I don't know who's going to get sick or how sick they're going to get. So that's the dilemma that we're in. This is just a step in trying to hold back some of that money that's going out of state and keep it here local to help your town.
And when you renegotiate these
Your rates are you'll get a rate renewal, I think, for January 1. So I base these rates, thank you for asking that question. These rates are based on your current situation and would be subject to change. So as you get closer to your decision, we'd want to make sure we rerun these numbers for you. But in concept, this is how it works. You pay less, you get a better benefit, and you hold that money back to help your town.
And the contract is up, this has to be in place January, or is it?
You can actually, I think, change whenever, but the sign-up date is between, but you can change your health plan whenever you decide to, if you do. But Anyway, the point of this was to present it to this committee, and if you don't have any objections, for me to schedule times to talk with our employees about this. I mean, if it's something that you
Any other
think has...
questions? Anybody have any comments, questions, anything from the public? I'd say
I move to move this forward to the council.
move forward to council, second. Okay. All in favor? Okay. All right. Thank you very much.
Thank you.
Very good, thank you.
Thank you.
Appreciate your service to the town.
The next item is discussion of public safety.
Okay. So, there's a memo, and it was posted on our website as well today. And the purpose of it is to discuss the idea of transitioning our separate police and fire departments to a public safety model. And as you know, I have been wrestling with the issue of the resignation of our former fire chief since April. And although the concept of establishing a public safety department is discussed in the town's comprehensive plan, it was not originally my intent to attempt that kind of a transition at this time. We went through the process of soliciting resumes for the position of fire chief from both inside and outside the department, and received a small number of resumes. A committee reviewed those and interviewed applicants and came to the consensus that while there were some capable people who applied, there was not one that the committee felt was ready to take on the challenges of this department. We also had an overall review at the 10,000-foot level of the fire department by a small group of chiefs from the Maine Fire Chiefs Association, and a draft of that was received and returned to them for some additional information. In the interim, our Assistant Chief Michael Denning has been performing the role of acting chief and is doing a good job in that capacity. But he does not want to take on the fire chief administrative responsibilities full-time. He is agreeable to remaining in the position of deputy chief and being responsible for the overall day-to-day operations of the department. And on the other side of the house, our current Sergeant David Winchester would assume a similar role for police and dispatch. Our current police chief, Sean Gagan, would step into the role of public safety director as the administrative head of the 3 public safety divisions. And while it was not my intent to pursue such a transition when this process started, in the months since, I have come to believe that it would be in the best interest of Bucksport as a growing community. The 2 departments already share a building. Creating an administrative structure that ties them together is a logical next step. And the key to success in communities that have made this transition, and there are a number who have had, lies with the people that are put in charge. And I believe that we have the right people in place at this time to make this change, and the opportunity to do so without negatively impacting anyone's job. That said, the full implementation of such a transition could take up to a year. On the fire side, it would be easier than on the police side, and both Sergeant Winchester and Assistant Chief Jennings would remain in their current rotations until on the fire side another firefighter was hired, and on the police side the process of replacing a sergeant was completed. I understand that this would be a change for the community, but I believe it would be one that looks toward the future. And what I'm asking from this committee is the opportunity to discuss this proposal with police and fire personnel and bring it back to the full council for a vote at the meeting on October 24th.
Comments? Motion to push it forward?
Second.
We have a motion and a second. Any discussion, public comments? Anything else from the committee here?
I would just like to add that I think the town manager is correct, and I think that the key to the success of something like this are the individuals involved, and I'm very comfortable in saying that the 3 gentlemen in this case that are being discussed this evening, I do have that faith.
Agree.
Okay, we have a nomination, a second, all in favor? That's the end of the agenda items that I have. Anything else?
Motion adjourned.
Motion to adjourn,
Second.
We're adjourned.